Medical Center Aurora ER. This is Ellen. Go ahead.
Good afternoon, Aurora South. This is Paramedic Salazar with Medic 104. We are en route to your facility routine with a 67-year-old male. He's a chief complaint with sudden onset of left-sided facial droop, slurred speech, and left-sided weakness. Vital signs are as follows. He has a blood pressure of 190 over 110, pulse of 66, normal sinus on the monitor, no ST changes, no ectopy, respiratory rate of 16. We're working on IV access and have him on oxygen by now and breather at 15 liters. This will be a pre-hospital stroke alert. Any questions?
No questions at this time. We'll see you in 5 to 6. Medical Center Aurora clear.
Okay, thanks very much. 104 clear.
Please page Dr. Scott and call a stroke alert for room 1, please.
When it comes to strokes, the Medical Center of Aurora knows that time is brain. In addition to being a primary stroke center, we now offer the latest in stroke technology, remote presence robotics. The InTouch Health Remote Presence telemedicine technology is an advanced computer system that allows a neurologist off-site to immediately assess and direct treatment for a stroke patient.
He has a 18 gauge in his left AC, bloods are taped to the bag, no known drug allergies. Any questions for us?
Let's go and get him on over. What are you feeling right now? Have any pain anywhere? No? Okay. We have Dr. Wagner here, and he's going to be talking and ask you some questions.
Okay, sir. Is it true that you were normal about 2 hours ago?
With live two-way audio, video conferencing features, and camera capabilities, as well as access to remote medical devices, a neurologist can conduct a detailed evaluation of the stroke patient, even though he is not in the room with the patient. This thorough evaluation before the on-call neurologist even arrives affords opportunities for quicker, more effective administration of TPA. The quicker the treatment, the greater the chances of restoring blood flow and saving brain tissue.
Hello, sir. I'm John Scott. I'm one of the neurologists here on staff.
Hi, Chuck.
Nice to meet you, sir. Dr. Wagner, nice to see you again.
Hi, Dr. Scott. Let me give you an update on what I know.
Above all else, we are dedicated to the care and improvement of human life. For excellence in stroke care, you can count on the Medical Center of Aurora.
Strokes can cause a variety of symptoms. Often we train our patients to recognize just a few simple symptoms that may indicate a patient is having a stroke. One is facial weakness. That's what the F stands for in the FAST acronym. Facial weakness. So you can ask a patient to smile. If they smile and they have weakness of one side of their face, that may indicate that the patient's having a stroke. The A stands for arm. Have the patient hold up their arms. If they can hold up their arms and they're not weak, or if one arm drifts down or it's weak, that may be a sign of a stroke. If you notice any weakness in the leg as well. The S stands for speech. Speech is often affected in patients who have stroke. Either they can't understand, they're not speaking correctly, or their words are slurred. The T stands for time. Time is critical. Patients that have strokes need to be treated immediately. And so if you suspect somebody's having a stroke, it's very imperative that you call 911 and get that patient immediately to the hospital. TPA is a medication that has really changed the way we treat strokes. The majority of strokes are caused by lack of blood flow to the brain. We call those ischemic strokes. TPA is a medication that breaks up blood clots. Most often, strokes are caused by a blood clot in one of the arteries that's preventing blood flow to the brain. TPA works by breaking up that blood clot and hopefully restoring blood flow to that part of the brain. Well, the golden hour is a term that we often use here in the emergency department. It indicates that from the time a patient arrives through the door to the time they are treated with TPA, we like that to be in less than an hour. To properly evaluate a patient, there are certain things that we need to do to determine whether or not they've had a stroke and whether or not they're a candidate for TPA. It's very imperative that we do that within 1 hour time frame, and that's why we've implemented the telemedicine program throughout all of the Health One hospitals in the Metro Denver area to make sure that all of the patients, all of the hospitals can fulfill that criteria of treating patients with TPA within 1 hour. Stroke is primarily caused by a blood clot to the brain. The main risk factors for stroke are some of the same risk factors for heart disease. So we think of high blood pressure. High blood pressure is one of the biggest risk factors for strokes. Diabetes, particularly poorly controlled diabetes. High cholesterol, cholesterol that is not treated with medications and is out of control. Smoking is a big risk factor for strokes. Obesity is also a risk factor for stroke. There are certain less common things, but those are the majority of the risk factors for stroke.